everyone. I'm Christina Gallant. I'm a nurse and a lactation consultant here in the Women and Children's Department at the Moncton Hospital, and this is my colleague Kelly, who's also a lactation consultant. And we decided we'd put together a few videos around some educational topics that we thought you guys might find interesting. This is our first one, so please bear with us. We're going to try to do it all in one shot and hopefully give you guys some good information on a variety of topics. And the first topic today that we're going to cover is keeping a baby skin to skin or breastfeeding during painful procedures. So after delivery, all stable babies should be going skin to skin with their mom, and this doesn't necessarily have to be just full-term babies. Sometimes babies that are late preterm are stable enough to be able to go skin to skin as well. And this is really the best place for a baby to transition to extrauterine life. It helps keep them warm, it regulates their heart rate and their respirations and their oxygen saturations, it helps them keep their sugar up, and it also improves the bonding between the mom and the baby, helps with hormone releases, and helps to get breastfeeding going off to a good start. That being said, skin to skin after delivery is not just for babies that are breastfeeding. It's also for babies that are formula feeding as well, because as I said before, this is really the best place for them to be transitioning after delivery. Ideally, we want that baby to stay skin to skin for at least the first hour after birth, or until the first feeding is done. So sometimes you're going to have moms who have longer repairs, who have maybe bled after delivery, and so the baby couldn't go skin to skin right away. Don't watch the clock and say, okay, the 1 hour is up, skin to skin is over. If the baby is still actively feeding and the baby hasn't had that full time to be skin to skin, then it absolutely can go on for longer than that. Really, all of those initial assessments that you need to do in the first hour after delivery can be done skin to skin. So all of your vital signs can be done skin to skin, and really you're getting a more accurate representation of what the baby's true vital signs are, because the baby's not stressed, the baby's nice and relaxed, so it's a lot easier to count respirations and count heart rate if the baby is skin to skin. So we want to do our vitals. We want to do sort of a modified head to toe assessment. You're probably not going to be able to get in all those nooks and crannies, but you'll be able to see, if there's any glaring abnormalities. And then afterwards, once the feeding is done and you're getting mom washed up, you can bring the baby over to the warmer, do the weight, do the measurements, and then maybe do like a little bit more of an in-depth head to toe assessment. So Kelly here has a little model of a baby. This is Lulu. And so you'll have to use your imagination. So this baby is skin to skin after delivery. Just has on a diaper and a hat with a blanket covering over the back. And so from this position, I can quite easily listen to respirations, listen for heart rate, listen for air entry. I can also do a temperature quite easily from this vantage point, all while the baby is skin to skin. And you really want to go over what the main points are with the family about safe skin to skin. So they should always be able to see the baby's face. We say visible and kissable. So the parent should be able to see that the baby's mouth and nose aren't obstructed. The baby's up and down with the legs out, kind of frog-legged. And I always also remind the mom that it's wonderful to do skin to skin. It's a really restful position for the mom, and it's okay if they're kind of drowsy, as long as there's someone else in the room that is watching them and that's actively awake. But if mom and dad both want to catch a nap and mom wants to sleep, then the safest place for the baby to be is back in the bassinet. So everyone's going to find sort of a routine that works out well for them. I know a lot, it's a big transition. People have kind of their regular schedules that they would do after a baby is born. But something that I typically do, we really want to promote skin to skin and breastfeeding for painful procedures. But I think that for that initial breastfeed, um, a lot of times it can be challenging to get the baby on. The mom, isn't necessarily comfortable, especially if it's a primip. You're trying to figure out the right positioning, and then finally the baby latches. And so to me, that's not a time when I want to be manipulating the position of the baby in order to give the vitamin K and give the hepatitis B vaccine, because I feel like that's kind of like a protected time for feeding. Um, that being said, if you have a multip who's really comfortable breastfeeding, she's latched the baby easily, the baby is sucking vigorously, then maybe at that point you could give the immunizations while the baby was nursing. But for me, I usually just let the feeding finish and then afterwards position the baby in this upright position to be able to do the immunizations. If the baby is breastfeeding, of course, they're going to be laying to the side probably, and you're only going to have access to the top leg. And then you'll have to unlatch the baby, put them on the other side to be able to get access to the other leg. And that's fine, but you might not want to be latching and unlatching and moving the baby and stuff when they're just trying to figure things out. So for me, I like to just put them in this frog-legged position. So we'll pretend that I've got my vitamin K and my Hep B here. And so from this side, I have the bed up so that I'm not bending over. I can just take the baby's leg like this. I usually put their knee in the crook of my thumb and my index finger so that I can stabilize it really well. I'm going to do the cleaning, and then you can quite easily give the injection here, and then that finishes. Tuck the baby up, the baby cried, but the mom is happy because the mom is there soothing the baby. And then I just go to the other side of the bed. I don't know if you can see me over on this side. Tilt it a little bit. And then same thing on this side. So put the knee in the crook of my thumb and my index finger so that I can bend the knee. I'm going to clean things off, and then I can give the second immunization over on this side. And then hasn't really been much disturbance. And so you will find that generally the babies cry for a much shorter period of time. And whenever I do that little bit of teaching with parents about that their baby is less stressed and that it's more comfortable for the baby if the mom is holding, I've never had anyone say, oh, I don't want to comfort my baby while they're getting a painful procedure.
And all this could be done on dad or partner's chest if mom was not feeling well.
Yeah, absolutely. So, sometimes the mom is unavailable, and so in those kinds of cases, it's always good to get skin to skin going with dad. They're often the ones that can really warm up a baby if the baby is cold, and good for bonding. A lot of times you'll get questions from families that say, I'm breastfeeding, but I want a way for my partner to be able to bond with the baby. You can always suggest skin to skin. It's a really great way for bonding to occur. So that's basically the labor and delivery side of things. This might take a little bit longer. I know typically we would bring the baby over and do the head-to-head or head-to-toe while the mom is getting washed up, and so you might have to kind of revamp your schedule a little bit. But it is best practice, and it's where, it's the direction that we're moving in. Not everything has to be done as quickly as possible. Of course, there's going to be some times when you're in a rush to get someone out because you have someone else that needs the room, but the majority of the time, you probably do have an extra 5 minutes to be able to give that baby some good pain control. Now, moving out into the 2600 unit, so in labor and delivery, you'd have vitamin K, hepatitis B, and typically that would be it. Out on the 2600 unit, you might have a baby that needs to have a gluc drawn, a baby that needs to have an AccuCheck. All your babies are going to need their newborn screening done. So these are all ways that you can provide comfort to that baby while they're having those painful procedures. So I always like to use one of these little heel warmers. And so you just crack it, put it on the baby's foot. I would go in, if the baby needed a newborn screening done, I would come in a few minutes before and say like, okay, your baby is due for some blood work, explain what that is, make sure that I have consent from the family, and then let them know that the preferred position is for the baby to be either breastfeeding or skin to skin, and then put the heel warmer on at that time and kind of get them situated, and then you can go and gather your supplies and come back, and usually by then you're ready to go. So I'll just kind of give like a couple examples. So I'm right-handed. I kind of prefer to be on the other side. I'll just slide this over a little bit here. So this is the ideal position. You have the foot that's down. Gravity is working with you. They're nice and warm because they're skin to skin with the parent, and mom and dad are going to be able to hold the baby, so you're not worried about the baby kicking or flailing or rolling all over the place. So to me, this is really the ideal position. And if you need to, you can always just put the bed up a little bit more. So you've got your picker. You're going to hold the foot, bend it up like you normally would, clean it off, do your pick, and then 1 drop, 2 drops, 3 drops, 4 drops, 5 drops. Put your pressure on.
Mom can hold pressure.
Mom can hold pressure afterwards, and it's as easy as that. Same thing goes for if the baby needs an AccuCheck, if you need to draw blood into a container, or if the lab needs to draw blood. So you're cleaning off, you're using the picker, and then there's no bending, there's no strain on your back. It really is a very comfortable position. Now, we know that a combination of breastfeeding and skin to skin is beneficial for painful procedures. So if the baby is out on 2600 and breastfeeding is becoming more well established and you want to do this during breastfeeding, that is great too. So the baby, you can put the baby in sort of a cross cradle position, and then this foot, the one that's the top leg, is dangling right there for you. So again, you're going to have your heel warmer on beforehand. You can hold on to your foot. Mom is stabilizing. Sometimes I find they want to kick that other foot underneath, so you can ask mom to hold underneath. You clean off, you do your picker, you get your blood. Gravity is working to your advantage. And then that's it. It can be done in other breastfeeding positions as well, not just this sort of cradle hold. If the baby was football, again, you're just going to go behind. You have access to both heels back here on this side. I don't know if you can see super well on that side here. Maybe we'll go on that side, Kelly. So again, over on this side, if you're left-handed, you can pick here. If you're right-handed, you can pick up here. Use your picker, draw your blood. And if you were giving those immunizations and the baby was breastfeeding, again, you've got full access right here. I would maybe get mom to move her arm down so that I had better visualization here. But it's quite easy to access that top leg. And I really think that the more often you do it, sort of the more comfortable you become with the positioning, it really does become easier because the baby is so much more cooperative.
And mom and dad are much happier.
Mm-hmm. And the thing is, in terms of messaging, online videos, things that you're getting in prenatal classes. There's a big push for skin to skin during painful procedures. And so we have people coming into the hospital and they're aware of this and they want to do skin to skin for painful procedures. And then if we don't provide it for them, then it can be confusing for the parents because they know that it's, sort of an emerging best practice. And so it'll just take a little bit of time, and be patient with yourself. Try out some new things, try out a different schedule. But overall, ultimately, it really is what's best for the baby. So that's it for our content for today. I hope you guys learned something, and we hope to bring more videos and more topics to you guys soon. There's going to be a new section in the staff room. It's going to be an infant feeding focus, and there'll be some resources up for the month of March, and we'll change topics every month. And so this month's topics are going to be around skin to skin during painful procedures. So follow the links, watch the other videos, and let us know anytime if anyone has any questions. You can reach us by email or just come and see us on the units. Okay, thanks.